issues that impact the Black community as well. And one of those issues is breast cancer. And here to explain is Dr. Camelia Lawrence, Director of Breast Surgery for the Hospital of Central Connecticut and MidState Medical Center. Doctor, welcome.
Good afternoon. Thank you for having me, Lisa.
Thank you for being here, Doctor. So what do we know about Black women and breast cancer?
Well, we do know that the rates of breast cancer among Black women and white women are relatively close. However, Black women are almost twice as likely to die of their disease when compared to any other subgroups.
So people hear that, and the big question is why? Why are Black women almost twice as likely to die from breast cancer?
You know, there have been several factors that have been evaluated as it pertains to poor outcome in Black women. Some includes, disparities in racial disparities in screening mammography, which often leads to differences in diagnosis, stage of diagnosis, as well as the size of the tumor. Tumor biology plays an important role. We do know that Black women are more likely to develop a type of breast cancer known as triple-negative breast cancer. And triple-negative breast cancer appears in younger women. There's a higher propensity for metastatic disease, which is disease in other organs, as well as increased frequency of recurrence of the disease. And I also think socioeconomic plays a role, as well as access to care. That's a big part of big part of what contributes to the disparities.
So the next question is, how can we stop this from happening?
I don't think there's a single solution. There are a couple things that we can do. One is to increase access to the treatment, including diagnosis and treatment of breast cancer. Also, I think it's important to look at why Black women in particular may not be completing the recommended duration of treatment. In addition, I think the elephant in the room here is also creating a culturally diverse and competent group of treating physicians. We know that representation matters. Physicians of color account for only 5% of physicians in the United States, yet we're about 13% of the population.
And Doctor, what would be your advice for Black women, but also women in general, when it comes to breast health?
I think, breast cancer, when caught early, is a very treatable disease. Early diagnosis is key. I would tell any woman, make sure you're getting your mammogram. We know that mammography saves lives. I think it's important to have conversations with your family about your family history. We know that family history is king. If you are at an increased risk for breast cancer, there are different surveillance programs that you may find beneficial. The current recommendation for screening mammography is age 40. But if you happen to have a strong family history and an underlying genetic mutation, your screening may commence as early as age 25.
All right, Hartford Health. Camelia Lawrence, thank you very much for all the great information.
Thank you for having me.